first, let's talk about the exciting data at this ESMO on neoadjuvant therapy of HER2-positive disease, in particular the DESTINY-Breast11 neoadjuvant clinical trial. Can you just tell us a little about the study design, the randomization, et cetera?
Absolutely. So I would start off by saying practice-changing data and really, really exciting data. So let's talk about the trial design. DESTINY-Breast11, as you mentioned, is a neoadjuvant study that really asked the question of whether we can replace anthracycline with trastuzumab deruxtecan for high-risk HER2-amplified breast cancer, primary breast cancer. And so the trial randomized patients to receive dose-dense AC followed by THP or trastuzumab deruxtecan followed by THP with a primary endpoint of pathologic complete response. The trial was a multi-center phase 3 trial that was conducted globally. And ultimately, the patient population, I would say, is quite representative of what we see in clinic. In terms of the primary endpoint, pathologic complete response, there was a delta benefit of 11% favoring the trastuzumab deruxtecan followed by THP arm versus AC THP. I would call this a clinically meaningful advance in pathologic complete response rate. That is why I started by saying I think this is practice-changing data. But I'm sure we'll talk a little bit about the adverse effect profile and so forth, because of course there are considerations as we think about applying this to our patient population.
Now, what about the control arm? You know, it had an anthracycline. Is that the right choice of the control arm, do you think, or could it have just been TCHP?
Yes, well, as you know, I've trained on the East Coast, and part of our East Coast, West Coast discussions, which I'll inform the viewers, have been anthracycline versus non-anthracycline containing regimens. So I would say that we have certainly moved away from anthracyclines in the HER2-positive setting, and I think that's largely because of advancement in what's available for residual disease and better HER2-targeted therapies. However, that being said, this trial, DB11, was designed for a high-risk population.
Exactly.
And we say what you will about anthracyclines, but they are effective and particularly effective for our high-risk patients. And this trial was designed to address that high-risk population. I think it was completely appropriate to have an anthracycline-containing regimen in the control arm.
It was a particularly high-risk group, I understand. Many of them had inoperable disease at diagnosis.
Yes.
Or operable plus node-positive disease as part of the
Yes.
eligibility. So it was a kind of higher than average risk group, perhaps, in that regard.